So I'm here today with Dr. Victoria Thomas. Would you like to introduce yourself, please?
Hi, I'm Vicky Thomas. I'm a consultant paediatrician and I've worked for the last 5 years at the Great North Children's Hospital in Newcastle upon Tyne. I'm an acute general paediatrician, which means I see children who come in through the emergency department. I look after patients who are on our inpatient wards, and I also have a specialist interest in growth and feeding, especially for children who are having a particularly difficult time because of other medical problems.
Okay, and although you're a fully qualified doctor, consultant paediatrician, you're not here going to be talking about particular advice for individual children, but we are going to talk about some general things that can happen to newborns.
Absolutely. So this is, if in doubt, see a doctor or other qualified medical professional is always going to be the bottom line here.
Absolutely. What we are going to do, though, is talk about some of the signs and symptoms that maternity nurses might come across in the children that they're looking after. So how would we know if a small baby, an infant from 0 to 3 months, becomes very ill?
Okay. So the first thing to say is that if you're worried and it's something you can't put your finger on, you're usually right to be worried. Okay. So I hear a lot of people concerned that they're going to be labelled as neurotic or over anxious. If there was one phrase I would like to ban, it would be anxious mum or neurotic mum, because most parents who are worried about their children present appropriately to an emergency department. So if you've got a baby and they're just not quite right, they're not behaving like themselves, that in and of itself is a very valid reason to get your baby checked over. Then you're talking about other things. What I think about it, I guess, is the ABC: airway, breathing, circulation. How do those things manifest? So airway, if you've got a baby that's making noises when they're breathing and they're new noises, and that seems to be making it hard for the baby to breathe, that's a reason to get the baby checked out. Breathing, any sucking in here at the neck. I can't show you on me because I'm not going to lift my top up, but in the ribs, where you see that sucking in when the baby's breathing, that's a sign that the baby is struggling to breathe. Circulation, so a baby who is mottled, grey, pale. And then those sort of broader things, a baby that's not moving as much, a baby that's crying absolutely inconsolably and cannot be settled no matter what you do. A baby who is feeding less than usual, so certainly if they're feeding less than half their normal amount, that baby needs to be seen. And a baby that's peeing less than usual. So we're looking for at least a wet nappy every 6 hours. And I think those would be my handful of things to be aware of. The other thing that we often get brought to our attention is babies with high temperatures. And I think that's an important thing to know about. A baby under 3 months with a temperature of over 37.5 degrees on your home thermometer, that baby needs to be assessed. It may be just a cough or cold illness, but it may be that baby's got a serious infection. But even if that temperature is normal, I always say to parents, think about why you did that temperature. If you did that temperature because you were worried about your baby, then a normal temperature is not a reason to just pack the thermometer away and get on with your day. If you're worried for a reason. Does that make sense?
Absolutely. And what out of those are the red flags that are sort of do not pass go, don't phone 111, go immediately to an A&E department or call 999?
So I think that baby that is unresponsive, that is fitting, that is not breathing normally, and that is pale, looks like their circulation isn't normal, these are all valid reasons to pick up the phone. But it's especially a baby that's not breathing, not waking and responding, and a baby where you look at them and you think they're fitting, that's where you dial 999.
And without talking about the emergency sort of situations like we have been, what are the most common illnesses that we might see in new babies?
Yeah, so new babies, the things that we often see in hospitals, if we're talking about the babies under about 3 months, we see lots of babies where parents are worried about feeding issues. That's pretty common. Sometimes that's about families not knowing what's normal and just needing a bit of support with that. But sometimes that feeding problem is a marker for a significant underlying problem. And the other thing, probably the most common thing that we see in babies under 3 months, is an illness called bronchiolitis. That's an illness that pretty much every baby will get before they're a year old, but only about 3 in 100 will end up coming into hospital and staying in. In adults, that's a cough or cold illness, or in older children, a cough or cold type illness. But little babies, their breathing tubes in their chests are much smaller in their lungs than ours, and so when they get a bit narrowed and tightened up, those are the bronchioles, and that's where the bronchiolitis comes from. The itis means inflammation or swelling. Those babies can really struggle with breathing and also with feeding. So I know it's July, but in my mind it's
winter's coming.
It's coming. From about October onwards through to March, that is the vast majority of our workload, is little babies with bronchiolitis who need breathing help. Many of those babies will be just fine without intervention. Some will need to come into hospital for breathing support, and a very small number will end up in the intensive care unit.
Is there anything that parents or maternity nurses caring for babies can do to help avoid those type of illnesses?
So a lot of these illnesses are just out there and kids are going to get them anyway, but things like really good hand hygiene are important. Making sure that babies are not exposed to people with cough and cold illnesses. It's easier said than done, isn't it? Especially when you've got older children in the house who like to pick them up and slobber all over them. But hand hygiene is right to the fore of everybody's mind at the moment, and you know, I'm celebrating that because that's the best news ever for me. Reduce the spread of all sorts of viruses. That's really helpful.
And talking not from a hospital perspective, but perhaps from a community perspective, what are the most common concerns that new parents have about their baby's wellness that perhaps a GP might be dealing with?
Yeah, so we see lots of babies where there's concerns about vomiting, and obviously that can be completely normal. So that can be the baby who posits. About 80 to 90% of babies will have a degree of gastroesophageal reflux, just meaning stuff coming up from your stomach into your esophagus. And I often say to parents, that happens because your stomach is small. So your stomach is about the size of your clenched fist, okay? The esophagus, the gullet, is short in babies, and the muscle at the top of the stomach that connects the stomach to the gullet, that's quite loose in babies. Plus they spend a lot of time lying down, so gravity, it means that it's actually quite easy for stuff to come from tummy up into gullet. And the vomiting in a small baby, if that baby is gaining weight and otherwise a happy and well baby, you can be very reassuring about that. The babies that worry about are the babies who aren't gaining weight, or those babies who are always unsettled, always miserable, those inconsolable unhappy babies. That's when we go looking for something else going on. My colleague says sometimes that vomiting in a small baby is a laundry problem, not a medical problem. I have a problem with that statement because I suspect he's not the person in his house that does the laundry. Do you know what I mean?
Yeah, it can be a big thing for parents.
Yeah, and you know, that baby that vomits all the time, where you can't leave the house without having a change of clothes for you and the baby, where you feel almost embarrassed because wherever you go, your baby vomits like a whale. Parents can find that really stigmatizing and really embarrassing, and there's often a lot of semi-helpful advice coming from friends and family saying, oh, that's really not right, that's really not right. So we do see a lot of babies where it's about talking, look, your baby does vomit, which is normal, but we can understand that it's hard as well, without necessarily going down lots of investigations or treatments. Then there are some babies where that vomiting actually is a problem, because they're also not gaining weight or they're unsettled and unhappy, and we can explore other diagnoses in them.
Many parents will ask about vaccinations. What's your view, speaking as a paediatrician?
Oh, I could not be more pro. I think that's really important to say. So coming at it from a number of angles, partly I think the evidence and the science is really, really convincing. And I think I've sent you a link to a website that I find really useful to direct families to.
Yeah, we'll be sharing that at the end of the presentation so that everybody can click on that and have a read for themselves.
Right. But anecdotally, and I think stories are powerful. So I've been a paediatrician for nearly 20 years, and in that time, what the illnesses that we see kids coming in with have just changed. You know, when I was doing pediatrics first, we saw 2 or 3 children a month really sick with meningococcal disease. I did a straw poll in our office at work the other day, and none of the trainees who were in that day had ever seen meningococcal disease. And that's because of immunization. So, you know, it's not just a theoretical to me. In my working lifetime, I have seen the impact of immunizations.
And what sources of information are reputable for maternity nurses to read themselves or to point parents towards when parents are concerned about their child's well-being?
Yeah, so I'm a massive fan, obviously, of the traffic lights guidance that's come out from NICE, because I think it's straightforward. I've sent you a link to, because I have to plug my own local service.
Absolutely.
So I've sent you a link to the Little Orange Book, which was produced by Newcastle and Gateshead CCG, which is a really fantastic short resource on emergencies and health, simple health problems in children. So I think they're fantastic. I'm a big fan of a couple of organisations that I'm involved with. I have an unpaid role with both of those. Is that all right to mention?
Absolutely,
that?
yes.
There's an organisation called BASIS, which is the baby sleep information source. I've been working with Professor Ball from the Durham Anthropology Department for some time.
And our maternity nurses are have had a talk by her already on infant death.
So I mean, I think Helen's work is fantastic, and I think it's really practical, supportive advice for carers about how to manage infant sleep. I'm a trustee of First Steps Nutrition Trust. Again, that's an unpaid role, which I've taken on because I respect the organisation. And I think that's a great resource for infant and young child feeding, for really sensible stuff there. The NHS website is great for any kind of queries. And I think at the end of the day, build up a great relationship with your local GP, because I cannot, as somebody who's lucky enough to be a hospital doctor with massive of resources and staff and machines that go beep, I cannot respect GPs anymore. The work that your GP does is so fantastic. They really know their stuff. So get to know your GP. They will stand you in great stead if you're worried about your little one.
Thank you so much for your information and your advice today, Vicky.
Thank you. That's really great.